I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're doing today is one of our frequently asked question shows, and we get a lot of questions from you, the listeners, on drjoe.com, our website. And, of course, when we do our live radio shows, people call in with questions, and people send it through the live streams that we do a lot of. And so we pull questions periodically. We might want to do this, Garrett, maybe more often, maybe even once a month.
Maybe once a month.
Yeah, I like this is a fun thing because everybody has these same questions. And so we will, and we can do it for our Sunday night show, too. Why not? Yeah. And we'll go ahead and answer questions for you guys. So if you have any questions, you can go to our website and search the website, first of all, because chances are we have an answer for you, drjoe.com. And if you don't find the answer there, or you just don't listen to me, you can go ahead and send us the question through the website, and then I will say this is where it is on the website, or Garrett will, or Sarah will, or Joe will, or whoever, somebody who's answering questions for us. But so this show today, we're answering questions that people have sent in. So we have Garrett and Sierra here with us today, and who's next for the question?
I think it's me.
All right. It's always you, isn't it?
It's always me.
Even if it's not you, it's still you.
Yes. Garrett should know this by now.
Yes. Listen to her, Garrett. What's wrong with you?
What are some tips that you have for going vegan?
Going vegan.
And if anybody's watching our stream right now, share some of your tips.
Okay, that's a good idea. Yeah, because we live stream these folks. Oh, by the way, that's a good point. We live stream our shows, so if you're not doing it now, if you're not doing it yet, you need to follow us on Facebook and Instagram. It's at Dr. Joe Esposito. And I always say, we give you all this information for free. We answer your questions for free. Your cover charge, there is a fee. Your cover charge, you got to follow us on Facebook and Instagram. I think that's pretty reasonable cover charge for all this information you're getting. We have doctors and medical schools, chiropractic schools all around the world air these shows as classes. So you guys are getting postgraduate information for free. But the cover charge is follow us at Dr. Joe Esposito, Facebook and Instagram. That's all I ask. And then you're in. You're part of the cool kids then. So going to a plant-based diet, and there's a difference between vegan and plant-based. So let me cover that first. Vegan is you don't eat any animal products. But you can eat breads and cookies and cakes and donuts and pastas and chips and fried foods. And you can eat very poorly and still be vegan, because vegan by definition is no animal products. Plant-based is no animal product. Actually, some people say you can have animal products, but plant-based is mostly whole foods. What I mean by whole foods is the least processing available. So if you have lettuce, that's great. That's very low processed. But if you have, soup, let's say, it's been processed. A little more, still not bad. But then when you start having, let's say, chips or things like that, that's super processed food. So you can take corn, organic corn, and then grind it into a corn meal and then fry it. Now you're getting to super processed foods. And that's now no longer plant-based. So plant-based is mostly fruits, vegetables, nuts, and seeds. So how do you do that? Go to our website, drjoe.com, and type in the search bar, so what can I eat? And we do a whole hour on the show of what to eat. Breakfast, lunches, dinners, snacks, parties, raising kids. We cover it all. Now, my book, Eating Right for the Health of It, is also an excellent guide to going plant-based. And the first half of the book tells you how to change your diet. And the second half of the book is well over 200 recipes. And by the way, if you follow us on Facebook and Instagram, sometimes Garrett gets really sneaky on me, and he will send out a code or something like that and give you a free copy of one of our books, the digital version, not the hard copy. So by following us, there's a lot of benefits to that, and sometimes Garrett does stuff he doesn't tell me, and he does things like this. So it's another benefit to follow us on Facebook and Instagram. But at Dr. Joe Esposito is where you follow us. Eating Right for the Health of It, great guide. So what can I eat? A great guide. Let's go through a day in a life. Dr. Joe, what do you eat? I hear that all the time. I want to eat what you eat. And a lot of the supplements I created, a lot of the foods I created, a lot of recipes I created were people saying, what do you eat? So this is how I eat. It's very simple. Start out your day with super greens and essential source. You have to start your day with that. That's like for many people, it's coffee. It's their burst of energy. A lot of people have given up coffee and stimulants because the super greens and essential source works so well. I personally take super greens and essential source, omega-3 fatty acids, because most of us are deficient in omega-3s, B-complex, glutathione, I take men's hormone support because as I get older, my hormone levels are dropping. I want to boost my hormones a little bit. I take estrogen regulator, which prevents my testosterone from converting into estrogen. I take digestive enzymes if I am eating a cooked meal. And so that's how I start my day. A handful of supplements, super greens, and essential source. Does not fill me up. I like breakfast. Some people skip breakfast. I'm okay with that. I can skip dinner. I can't skip breakfast. So then I'll have some fruit usually. Whatever is in season I'll have. And then I'll start my day. I'll get going and I'll start, shower and shave and get everything ready and get my clothes together and everything. Sometimes I'm okay. Sometimes I'm hungry. If I am hungry, then I'll have a little snack. Sometimes I'll have whatever was left over from dinner last night. I try to have something raw, of course. Salad usually works. Right around 10 o'clock, I'll start to get hungry. And I don't get hungry, I get shaky. I'll notice I'll be talking to a patient, my hand will start to shake. I said, time for food. So then I usually have several different types of nuts and seeds at my office in my desk. Yesterday I had pistachio nuts, sometimes cashews, sometimes walnuts, sometimes almonds. And then I'll have that. Lunch is almost always a salad. Salads are easy, quick, and cheap. Now, if you have a honeymoon salad, Sierra, what's a honeymoon salad?
Lettuce alone.
Lettuce alone. There you go. Sierra's least favorite dad joke. You can have a honeymoon salad, lettuce alone. But that's kind of boring. So shake it up a little bit. You throw in some other vegetables, peppers, onions if you want to, if you're not breathing on people. Carrots, you can shred up some carrots, celery, throw it in there. Throw in some nuts or seeds. Throw in a can of chickpeas, maybe organic, of course, organic red beans. Put that in there. You could use nutritional yeast, which really gives it a very good savory flavor. If you're a headache sufferer, nutritional yeast is high in glutamic acid, which is glutamate, which can trigger headache. So just be careful with that. 99% of people don't have a problem with it. Great source of B vitamins and amino acids. And then have that as your salad. Then for dinner varies. Sometimes I skip dinner. Depends if I'm going out to dinner, if I go home for dinner. But in my book, Eating Right for the Health of It, we have over 200 recipes, and we have a lot of dinner recipes in there as well. So it's not hard to do. It's very easy. It's simple. It's way less expensive than anything else you're doing. I'm amazed. I bring my lunch every day to work unless I have a meeting to go out to for lunch. Other people buy their lunch. And then I see lunch is $8, $10, $12, $15, $18. It's a lot of money. So you're going to save a ton of money by eating plant-based, bringing your own foods. You know the food is quality. You can pick what you want. You don't have to worry about monosodium glutamate or somebody spitting in your food or whatever it is. So there's no downside to this. Hummus is great. A lot of times I'll have hummus, and the hummus is so easy to make. Chickpeas, tahini, a little bit of olive oil, lemon juice, salt and pepper, throw it in a food processor, whip it up, it's done. You could add olives to it if you want to get crazy. You could add roasted peppers to it if you want to get crazy. And then you could eat it with cucumber chips. You can have regular chips if you want to. Not the best food, but okay if they're organic. I prefer you don't have them fried because the frying creates trans fats. So there's tons of different foods that you can eat, and I've never missed a meal. I've been plant-based now 34, 35 years. I've never missed a meal. I get invited all the time. In fact, Garrett was just telling me this week, we're getting invited back to corporations to start doing workshops and wellness workshops. So I've never missed a meal anywhere I go. Cruises, flying anywhere, traveling. There's always something you can eat. So it's not hard to do. It's pretty easy, but all the information's on the website. So what can I eat? Boy, that was a long answer. Next question.
If I live out of the area, how do I find a good chiropractor to trust or that I can trust?
Gosh,
and
that's
another way to word that would be, what should I look for in a chiropractor?
6'1", Italian? No. Oh, that's me. Never mind. That's a really hard question, actually, because I get that question a lot. Dr. Joe, I want to go to somebody who does what you do in Illinois. I don't know who does what I do in my hometown of Marietta, So it's a tough call. So what I usually do is I'll tell people to ask around. I like somebody who knows how to do applied kinesiology, which is muscle testing. I usually find that doctors do applied kinesiology, kind of dig a little deeper. Is the doctor trained in nutrition? And that's kind of what I look for. But the best thing you can do is ask your friends. Ask your coworkers, who do you go to? Who do you trust? And so many times you'll get a good recommendation that way as well. Unfortunately, I can't be everywhere. In fact, I only see patients out of our Marietta office, Duluth, Stockbridge, and West Cobb. Our doctors are all highly trained. And I mean this when I say this. All my doctors that work with me are as good or better than I am. So technically, they're amazing doctors. They're trained by me. They have their own skills. But here's the thing. They're my doctor. If I don't trust them taking care of me and Garrett and Sierra, I don't trust them taking care of you. So you're in very good hands with our staff. But if you're outside the area, I'd say start looking around, and you could ask about applied kinesiology and nutrition. Those would be the best advice I can give you. So, what else we got on our frequently asked question show?
What do you recommend for people in their recovery process, both pre and post-op, for any kind of surgery?
That is an excellent question. What do you do for people that are going into surgery and coming out of surgery? In my fantasy world, where I'm Surgeon General and Grand Poobah of the universe, everyone would have to do a very strict nutritional protocol. I would probably say 4 weeks before surgery and 4 weeks after surgery. We would save so much money. Healthcare costs would plummet. First of all, if they did this originally, they wouldn't probably need a lot of this services. Now, I'm not against surgery. Believe me, I've had surgery. I'm not against it. But if we took care of ourselves, we wouldn't have to spend all this money on surgery. But if you are going in for surgery, if you prepare yourself, chiropractic care, absolutely positively, no matter what the surgery is, you got to get the nervous system working the best it possibly can. You want to go to a plant-based diet. You want to stay away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. You got to stay away from these foods so the body has the nutrients that it needs to heal. I believe, totally my opinion in this statement, I believe that our death rate would drop significantly. The cost of healthcare would drop dramatically. And the outcomes would be much better if we do what I'm about to say. So, fruits and vegetables, nuts and seeds anyway. That's what your diet should be. Super green's an essential source, certainly. That goes without saying. Vitamin D to build the immune system. Digestive enzymes if you're eating cooked food. Glutathione to keep the liver healthy. Because pre and post surgery, many times there's medication involved. And the medication is always going to end up in the liver. You've got to do everything you can to get the liver to heal. There's also a supplement I may recommend called milk thistle, and we don't carry it on the website, but we do carry it from a company called Standard Process. And milk thistle is amazing for cleaning out the liver as well. So, fruits and vegetables, nuts and seeds, raw food, chiropractic care. If you have digestive issues, let us take a look, see if we can fix the stomach, hopefully before you go in, so you can absorb your nutrients. And then the anesthesia alone is a challenge. Sometimes people do very well with the surgery, but they don't do well with the anesthesia because it shuts down your brain. That's not good. It is if you need anesthesia, though. So we got to get the brain working normally again. And if you're eating saturated fats, meats and dairy products, fried foods, artificial sweeteners with aspartic acid in there, or glutamic acid, that'll cause the brain to fire faster than it's supposed to. You've got some real serious issues going on here. So we think about surgery, I go, let's go and chop you up and we're done. I feel that if we prepared before and after, we get way better outcomes. And so that's what I would suggest. And again, listen to the 7 Deadly Sins of Nutrition on our website, and So What Can I Eat on our website. Follow those guidelines, and in most cases, you're going to do a lot better. And that's always my goal, and I've tried. But we get quite a few referrals from surgeons saying, Dr. Joe, I want you to get this person healthy before I operate on them. They're too sick, they're overweight. We put them on a 21-day doctor-supervised weight loss program. Dr. Joe, we got to do everything we can to get this person healthy. Those are the doctors that I refer back to, because they understand that this isn't just about, slice and dice. It's about getting the person well. It's not just treating a number, it's treating a patient and a person. So those are the doctors that I like to work with, the ones that have that awareness. So that's a real good question, but that's what I would do if I was going in for surgery. Next.
What's causing my bad breath?
What's causing bad breath? Very, very common. How many people know somebody with stinky breath? Raise your hands. Okay, Sierra raised her hand. And she's looking at Garrett. No.
Talking about Garrett.
Okay, good. Garrett and Sarah, by the way, date. So in case you don't know that, in case you're a listener, that's why we play here. And Maggie's our office mascot, the dog. And does Maggie have bad breath?
A little bit.
Really? Her breath isn't that bad. She went to the vet the other day, and they said that her teeth were actually really good.
Good, because she's eating good foods. That's
She's
why.
spoiled.
That's because she's spoiled, right, exactly. So bad breath is usually caused by one of two things. One, it's a rotten tooth. There's something in the teeth. Now, I had an issue one time a while ago, and I couldn't figure out what it was. I ate a good diet, and I brush and I floss, and I was water picking. And I went to the dentist. He took an x-ray, and a little piece of food had lodged itself against the side of my tooth, and it calcified. As soon as he popped it out, breath was fine. So if it smells like rotten tooth, okay, and you might know what that smells like, it's probably an oral thing. May have to go to a dentist. If it smells like a dirty bathroom, and we know a lot of people that have that problem, that's a bowel problem. Because what happens is, anything in your colon can be absorbed into your blood system. So if you have really bad gas and rotten food in the colon, the gases can get absorbed into the wall of the colon, into the blood system. Those gases go to the lungs where air and oxygen and other gases are exchanged, and it comes out through your lungs. So you can brush your teeth all day if it's coming from the colon. So in cases like that, we have to look at, do they have acid reflux and heartburn? We may have to physically pull the stomach away from the diaphragm. Do they have constipation? They're eating a lot of meats and dairy products. The food is rotten in their colon. Are the bowels moving properly? The bowels should move once or twice a day minimum. We might want to get them on Dr. Joe's intestinal cleanser to get the bowels moving. We want to change their diet up a little bit. Chiropractic care is important because the nerves in the low back control the colon, the sex organs, and the bladder. So we may have to adjust them and open up the nerve and blood supply to the colon to get it working. But bad breath, it's a really good question, is a symptom. It's telling you that something's wrong. And so just ignoring it or covering it up is not a good thing. One of my friends actually had such a rotten tooth, I couldn't go near the guy. This is years ago. His breath stunk. And I don't know how anybody went on dates with him. I mean, it was just awful. And then one day he started having a pimple on the bottom of his chin, and it burst. And it was all infected. His whole lower jaw was infected. And so they had to go in there and scrape out the infection, and that's where the bad breath was coming from. But I told him many times, your breath stinks. He's like, I don't know what you're talking about. But it was a sign that there was a rotten tooth in there, and that was really important to find. So depending on what it smells like will depend on where the problem is. But if it's a potty smell, it's usually, we can do wonders, many cases, not all, with chiropractic and nutrition and fixing the gut, which is important for many other things as well. So, next question.
Oh, I'm sorry. I was not paying attention. Sometimes my jaw pops when I eat. Is that bad?
Yes, as a matter of fact. Your jaw has nerve endings in it called
Pay attention to this one.
This is Sierra. She's got to pay attention to this one? Okay. You want to tell your story, Sierra?
I can. I was in a car accident, I guess about 3 years ago now, 3.5 years ago. It was like front impact, and the airbag hit me in the face and did a lot of crazy stuff to my jaw. I went to a TMJ specialist for a while, and they recommended me to a surgeon, but I did not want to have a surgery with a 9 to 12 month recovery in regards to my job. So I started going to chiropractic care, and through all of the amazing chiropractors, because I've seen every single one of them at Dr. Joe's office, they've all been helping me to maintain my jaw, and I haven't had any issues since.
There you go. So yeah, popping jaw, like in Sierra's case, was extreme, but a popping jaw is a warning sign. It's telling you that there's a little pad in the jaw. The jaw is a hinge joint, and the little pad in there has come out of place. Now, there's, and don't quote me on this, I may be wrong, it's been years since I knew this, 32 pair of proprioceptive fibers in the jaw and 31 pair in the sacroiliac joint. So proprioceptive fibers tell you where you are in space. So I can't see the food that I'm chewing, so I have to know where the food is. So I have a lot of nerve endings in my jaw telling me move the food here, move the food there, chew here, don't bite your lip, don't bite your tongue. And so the proprioceptive fibers work really well to keep your body safe. The ones in the hip control balance. So many times when patients stumble, if they fall off balance, if they're awkward, they're clumsy, it's a sacroiliac and or a temporomandibular joint problem. It's affecting the proprioceptive fibers. So we can chiropractically adjust the jaw, like Sarah was saying, adjust the sacroiliac joint, reestablish the connections in the proprioceptive system, and amazing because it's not only feels better, but it allows the person to be safe. They're not as clumsy, they're not stumbling. And this happens a lot with seniors. I've taught many seminars on risk management when it comes to falling. And so it could be the sacroiliac joint, it could be the proprioceptive fibers, it could be the cerebellum, the back part of the brain, because balance is controlled by the proprioceptive system, the cerebellum, and the inner ear, the semicircular canals. And so if there's damage to any one of those, that can cause, that's why we have dizziness and off balance. So in fact, we just had a patient the other day, and Dr. Irwin and I worked on the patient together. An older woman kept falling to one side, and so we found she did have a cerebellar injury, lesion we call it. And so we adjusted just the side of her body, just the left side in her case, where the cerebellar was lesioned, and her balance got better almost immediately. And now it's going to be an ongoing process. It's not a one and done, but we want to be able to fix that. So popping of a jaw, chiropractic care in many cases should be your primary entry point. And then we got to check the sacroiliac joint, because if that's out of place, you may not hold the adjustment in the jaw. So I know it's a little complicated, but it's a lot of neurology I just taught you. But we've got to get the nervous system and neurology balanced, and that's what we do in our offices. We work on the nervous system, the digestive system, and the diet. So, next question. Almost out of time here.
What are some tips you have for pregnant women to stay healthy through pregnancy?
Absolutely, positively, no artificial sweet, none of the 7 deadly sins. So again, if I was Grand Poobah of the Universe or Surgeon General, this would be my rules. 7 deadly sins nobody should eat, especially women that are pregnant, because it's not about you, it's about you and the baby. So like things like monosodium glutamate can really irritate the baby's nervous system. Aspartic acid can do damage to the baby's nervous system. You have to stay away from mercury. That's fish. Okay, if you're in California, tuna cans and fish cans have warnings on them for pregnant women. Because mercury, if it gets into the body, can short-circuit the brain. And there's a lot of research out there on mercury and brain shortages and short circuits, Alzheimer's, Parkinson's. So many times it's a mercury issue. So I would say absolutely a plant-based diet just to be safe. Organic, so you don't get pesticides and herbicides and chemicals in the baby and into you. A lot of water, supplement-wise, Super Green's an essential source, which, by the way, everybody should be taking anyway. They're 2 powders. They taste great. We have mint flavor. We have regular, by the way, in these Super Greens. So I like the mint flavor. I like things a little sweeter. Some people like a little calmer. That's the plain. And then we have the essential source. I can't imagine a day going by not taking that. And if you were pregnant, especially, and breastfeeding, even more important. That you should be doing that. So supplement-wise, vitamin D, of course, got to keep the immune system strong. And your immune system is the baby's immune system. Your body is the baby's body. So here's a simple question you could ask yourself. If I'm going to eat this, would I feed it to my baby? And if the answer is no, then you shouldn't eat it yourself, because the baby shouldn't be eating what you wouldn't be eating. So a lot of fruits and vegetables, nuts and seeds, plant-based diet. There's no reason why you shouldn't be taking care of yourself. Now, many times with pregnancy, you need chiropractic care as well, because as the baby grows, it spreads the hips out, and that can throw the sacrum out of place. And the sacrum is attached to the uterus by something called the broad ligament. So if the sacrum rotates, you can pull on a broad ligament, which can pull on the uterus, and we don't want that if you have a baby in there. So I would say that every pregnant woman should have a chiropractic evaluation, absolutely positively. And then after they have the baby, you got to get things realigned as well so that it heals. Because the ligaments are going to stretch and move the joints around to make room for the baby. You got to get things realigned so when the ligaments tighten up again, they tighten up normally and not crooked. So we see a lot of pregnant women. There's even an adjustment called the Webster technique that my doctors are trained in that has been shown to sometimes turn a breech baby. Not always, but sometimes. Really cool technique. And I studied with Dr. Webster. I studied with a lot of greats because I'm old. And so... And they're not around anymore, but I am. And I took all their knowledge with me. So if you do have a health issue, folks, if you want to make an appointment to come see us, neck pain, back pain, shoulder pain, headaches, numbness, tingling, carpal tunnel syndrome, stop suffering. Stop saying, oh, it's going to get better. I'm going to try this. Just come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. The initial visit for chiropractic was $375. Through COVID, we've reduced that price to $149. That's an exam, x-rays, consultation, first adjustment, the second visit going over the x-rays, putting together a treatment plan for you, and doing a nutritional evaluation. After the first visit, and we go over everything, most insurances we accept. We work with car accidents, sports injuries, workers' comp, Medicare. There's no reason why you should be suffering in most cases. You should come see us. So you can make an appointment right now online, drjoe.com. It's real simple. My staff will call you once you do it, and we'll give you all the information, directions. If we have more advanced issues, we have arthritis, we have knee problems, we have shoulder problems, wrist problems, muscle injuries, we may want to go to our medical division and get some PRP. PRP is platelet-rich plasma. Platelet-rich plasma, and we take the proteins and we inject them back into your body to facilitate the healing. So it's your own cells that we're putting back into the body to facilitate the healing. It works wonders in most cases. And we talked about we can even use it for hair growth, facials, non-surgical facials. So a lot of amazing erectile dysfunction, a lot of amazing things can be done with PRP. In most cases, not all, and no guarantees. So if we need pain management, we have our medical doctors on staff, hormone replacement therapy. We can check your hormones. We maybe do it with supplements, maybe do it with plant-based hormones. So there's a lot of things that we can do to get your body healthy. So I feel it's the ultimate in the anti-aging medicine field, getting chiropractic, nutrition, digestion, and then the medical portion to get you well and keep you well. Again, the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. Catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.